Man, some of these histology pics are just beautiful. Okay, we got a 54-year-old man undergoing orthotopic heart transplantation, and he presents with fatigue, decreased exercise tolerance, and he's got decreased QRS voltage. A right heart cath and endomyocardial biopsy are performed, and we have dense mononuclear cell infiltrates with focal myocyte necrosis. Which of the following best describes the mechanism responsible for this patient's symptoms? So this guy's got a new heart, and that's been 2 weeks, and he's feeling tired, and they do a biopsy of his heart, and they see that he's got damage, and we got immune cells attacking that heart. So the body's immune system is attacking the heart, and that is called acute rejection. So what is acute rejection? It happens in the first few weeks to months after a transplant, and the problem is that you got the T cells, which is a type of white blood cell, see the new heart as foreign, right? And so then they attack that heart tissue. And what causes the dense mononuclear infiltrates? Well, the dense is going to be like a lot of the cells. Mononuclear is going to be the type of cells, so mostly the T cells and the macrophages, not the neutrophils. And the infiltrates, that would be the immune cells that have moved into the tissue and invaded it. So it's just invading T cells and macrophages that are crowded in one place. And so that means they're looking to fight the heart muscles. So on the biopsy, you see the dark purple immune cells, the T cells. Areas in the heart's muscle cells are dying, and signs of inflammation in the blood vessel would be like vasculitis. So the body is attacking, it's using the T cells. So now in terms of this question, how can we answer it? Given these histological findings and all that stuff, it's going to be our T cell mediated immune response against the donor MHC antigens. All right, so it's going to be our acute, and it's going to cause myocyte necrosis, which is a cell mediated. So it's going to involve T cells and macrophages, and also just the timeline tells you the host T cells recognize the donor MHC complexes, the HLA antigens, as foreign. That causes the CD8 positive cytotoxic T cells to kill the donor cells. It also causes the CD4 positive helper T cells to release the cytokines to recruit more of them, hence the density. And the end result is vasculitis and tissue destruction. And the histology shows these mononuclear infiltrates like T cells, macrophages, and the vasculitis. So the other ones, why is it not the performed anti-donor antibodies against the graft vessels? That would be hyperacute, and that happens in minutes to hours, and it's caused by your preformed, you already got them, IgG antibodies, and it leads to thrombosis and necrosis, not the lymphocytic infiltrates. That's going to be a little bit longer with your T cell reaction. Immune complex deposition, that is going to be a chronic rejection, and some vasculitides. I'm trying to think. Yeah, that would involve your antibody antigen complexes, so your type 3 hypersensitivity reaction, and it would not show this pattern of the T cells and macrophages in the biopsy. Gradual fibrosis, that would be your chronic rejection. That's months or years afterwards. Intimal thickening would be seen. You might also see like some fibrosis. And that's going to be what you look for gradual fibrosis of chronic rejection. So chronic rejection, immune complex deposition for sure, but definitely fibrosis later on. Type 1 hypersensitivity against the donor. That's going to be your IgE cells, mast cells, histamine, and that would cause immediate allergic reactions. Not going to be an organ rejection. So yeah, not that. Okay, hopefully this is helpful, and we'll see you in the next video.